Hello. Wow, what a week. We have just spent a week at Arab Health this year, and it is, I think we've been doing it for about a decade, and it is definitely the biggest that we have done, and not only in our participation in it, but the exhibit itself. And my name is Christina Sohatsky. I lead our healthcare and life sciences practice in Saudi Arabia, and I'm joined by Andrea Teichkot, who is our regional head of healthcare and life sciences here in the UAE. Now, we had a fully packed session where we spoke about quite a few hot topics, one being genomics research in the region, but with a focus on the UAE. Can you tell us a bit more about some of those key highlights about life sciences in the UAE and the genomics program?
Thanks, Christina. What an epic week. I can't remember an Arab Health, which I've been doing now for the last 10 years, where we've been so busy. In terms of life sciences, of course, this is a huge market now for the UAE. It's part of the vision strategy. We have new laws being issued in relation to research and genomics in particular, which we've recently written about in our Law Update magazine, which was published for the Arab Health Conference. Now, at its heart, Arab Health Conference was conceived as a medical products exhibition, and of course all the big players are exhibiting. But of course now it's much more than that, because it's visited by the whole ecosystem. We have government and private sector companies who are engaged in the life sciences sector, whether they are pharmaceutical companies, universities, big health institutions undertaking research. They're all here undertaking their meetings, putting their projects together and taking those forward. And what we find actually is there's a huge appetite for collaboration, local and international collaboration. We're now in an environment where life sciences can't be siloed. We have to look at this from a global perspective. And one of the significant considerations for the life sciences sector is how we manage the data that flows out of all of the incredible research that's being done. And we have several laws in the UAE that manage the situation around health data and who has access to it. There are some challenges in relation to how we share that data and how we make it available internationally. Dr. Ibtisam Al-Bastaki from Dubai Health Authority spoke about data lakes and sandboxes and how we can all play in the sandpit together, but in a way that is safe, manages the data safely, prevents it from hacking, which of course is a huge issue, and how we can all benefit from the advances in research and feed those through into precision medicine for the benefit of the community.
On our panel, we also had Dr. Marwan from the Dubai Science Park, which is kind of this hub for biotech and pharmaceutical companies and life sciences. And he also spoke a bit about the new way that they framed the Dubai Science Park and creating that, as you mentioned, the ecosystem for the collaboration. And ultimately, as we see, the theme during Arab Health was a lot about clinical trials and research and bringing in the AI and the genomics to feed into precision medicine, and that sort of translational research, taking it not only from the studies and the publications, but bringing it down to the level of the patient, and how do you bridge that link. And actually in Saudi Arabia, we recently saw the creation of the Saudi National Institute of Health Research, which was formed specifically to fund the clinical research that requires a link back to how the results will be applied to the patient, whether that's a clinical pathway or the health ecosystem in some sort of way, or feeding back into the pharmaceutical companies. But that sort of continuum, it seems to be a theme that we heard throughout Arab Health.
And in terms of the continuum and the ecosystem, there's a lot of great work still happening in the UAE, of course, and quite considerable developments in very recent times, as recently as just a couple of months ago. We have the establishment now of the new UAE Drug Authority. It's very new. The board of directors have been established. They're in the process of preparing their committees, terms of reference, and then putting in place all of the processes that will govern the registration of existing drugs, also novel drugs, orphan drugs, rare disease therapies, and also screening and diagnostic drugs coming into the country for all kinds of purposes. Cancer is a particular concern, and there's a lot of funding and governmental effort going into cancer services and improving cancer services. Now, in terms of that ecosystem, you have Dubai Science Park playing a big part in that. The Science Park has grown significantly. They have a very good set of regulations which are very commercially focused. They have excellent facilities at the Science Park, either a greenfield site or a complete turnkey lab ready to go, and attracted many companies in the research space and in the pharmaceutical space into the Science Park. On the public health side in Dubai, you have now Dubai Health, which is a fully integrated academic health institution as well as a public health institution, and they will inevitably do a number of significant projects to support the local community, one of which is their new cancer charity hospital. And we heard during the Arab Health Conference this week that they will break ground at the end of this week. Well, we are at the end of this week. So they're about to break ground on that incredible project, and they will develop a new cancer program for the whole of Dubai. Meanwhile, in Abu Dhabi, we have Abu Dhabi spearheading the National Genome Program, which has now expanded considerably, and with the help of SEHA and M42 in Abu Dhabi and support from the Department of Health, they will further the clinical trials that are already in process. They will attract new volunteers. They will expand their screening program and generate a whole cohort of new data for that project.
What we've seen, I think, this week is one way or another, when we speak about healthcare, we come back to genomics. And so one of the things you spoke on our panel about was the new law. If we take a sidestep to a little bit of legalese, but why is that new law significant? I know we already had a law here in the UAE, and what would be the key takeaways from those trying to take advantage of all the amazing programs that are being developed here in the UAE?
The new genomics law is critical for the country. We did have several laws that mentioned genomics in very ring-fenced circumstances, particularly in relation to the IRB approvals for clinical trials for small projects. The new law now encompasses every use of the human genome. At its centre, it requires any institution or organisation doing any work with the human genome to obtain a licence. And there will be several different kinds of licenses that will need to be obtained. It establishes a new national genome database so that all the data collected can be housed in one place. And then, of course, it's easier to manage what you're going to do with the data once you have it. In terms of using the genome, it allows the use of the genomes for research, diagnostics and screening, health treatments, and then feeding into precision medicine therapies. It also prohibits certain activities in connection with the use of screening and genomics. One of those prohibitions is employers are not permitted to genetically screen their employees prior to employment or during the course of employment. And importantly, insurers are not permitted to require genomic screening of their insureds for the purposes of insurance. The point being, of course, that no one in the community will be excluded insurance cover because of their genomic makeup. Hugely important law, brand new. We're waiting for executive regulations. We're waiting for all of the detail to follow. But I think in terms of managing risk for the community involved in life sciences and genomics work, it's a huge leap forward.
And sounds like a fantastic foundation to spring forward from here. And we heard Dr. Hilda speak on our panel, who was formerly at CEJA working on the population-based genomics program. And something she was talking about is, great, we have this population-based genomics programs, and that builds that foundation in research. But that's not enough. And so she was talking about building the knowledge-based economy, and again, going back to how is that then transformed into patient care and clinical processes, and even going to the infrastructure that is in the hospitals and the workforce. These all need to be prepared for it. So during this week, we heard quite a bit about educating the entire knowledge-based economy here, educating people to ensure that clinicians, to ensure that the different elements of the ecosystem know how to take these great programs and the great data, the great information that's coming out of it, and actually do something with it, and actually do something that is not tech for tech's sake or AI for AI's sake, but actually know how to make sure that it's patient-centric, that it results in something that improves the patient's experience with the healthcare system and clinical outcomes, the things we actually measure when we talk about value-based healthcare, as we do talk about quite often here in the region. And with that, stay tuned for part 2.